Well, this is a perfect segue. Let's talk about sunscreen because I know you've done a lot of sunscreen work. You and I sort of share some of the work together. Bottom line is a couple of questions, right? Does sunscreen work in preventing skin cancer, preventing melanoma?
To me, I think the answer is clearly yes. There's some studies out there. The challenge has always been a lot of the studies are retrospective, right? So if I asked you, how much sunscreen did you use 10 years ago or 5 years ago, there's going to be a lot of noise in that answer because nobody's going to really remember that
Yeah.
perfectly. But I think Adele Green studies in Australia prospectively, to me, have been pretty definitive on that, where they looked at 10 years of people using sunscreen every day or basically using when they felt like it.
Yeah.
And the difference in melanoma incidence was significant. So I think it's clear that that makes a difference. And again, as we talked about this earlier, but a simple behavioral change can really make a difference in your melanoma risk to do this. And I think that's been pretty clearly shown at this point.
Yeah, I completely agree. I mean, I think before there was some controversy. People think that people who use sunscreen may actually have more incidence of melanoma, but there was some sort of selection bias. There's some sort of recall bias. But the Dell Green study really put an end to it. And then, they followed people for 10 years, I think 1,600 or so patients.
Right.
But they were also only using a really low SPF of 16, not what we have today, right? And then I think they show like 50% reduction in incidence of melanoma for the group that was given sunscreen for free compared to the other group that didn't give a sunscreen, but they were, they can use it essentially.
Right. And no, it was a pretty definitive study to look at that. And some of the studies where I said, yeah, the people that use sunscreen more get more melanomas, but they're also the fairer skinned people. So
Sure.
you had to take the phenotype out, the skin type out to really balance things to do that. So, to me, I think that I feel very comfortable recommending it to my patients. I think it's important. It makes a difference, and it's really safe, Steve. The FDA coming out with talking about absorption studies. Some of these chemicals get absorbed into your skin. My response to that is two things. One is we've been using these same sunscreen ingredients for 30 years now. Most of them. There's some new ones, but the bottom line is, if all these hypothetical risks were true, we would have expected to see those, and we're not seeing them at this point. And I know the FDA is suggesting experiments to see what the absorption does and a variety of things along those lines. My answer to that is this experiment is done by tens of millions of Americans every weekend during the summer months where they're applying the sunscreen. We're not seeing those hypothetical risks. And with that many people using sunscreen over that.
So I just want to give some colors to what Dr. Rigel is talking about. So FDA did two studies, and they give their subject, I believe, 2 milligram per centimeter square concentration of sunscreen, use it 4 times a day, cover the whole body, and then they draw blood, and they actually show some of the UV filter actually gets absorbed into the bloodstream. It sort of exceeded the level 0.5 nanograms per mLs. And so that triggered this whole aspect about studying. And you're absolutely right. Not only millions of Americans using sunscreen, people across the world are using sunscreen. Right? And then I think the
That's
FDA,
right.
the most important thing is FDA also made a statement that people should not stop using sunscreen. And you have to look at the risk and benefit ratio.